Shall we wait a minute or two, or shall we start?
I think you're okay to start.
All right. A call to order this meeting of the Health and Human Services Board. Today is June 18th. Welcome, everybody. We are on YouTube, so maybe for our anybody who is listening in public, we can go ahead and introduce ourselves. I'll start. I'm Diane Morehouse.
I'm Chris Corpola, the Human Services Director.
Gary Steen, District 5 County Board Rep.
Sarah Kennedy, District 22 County Board Rep.
Jody Cromery, District 13.
David Bartlett, Dunn County Board Chair.
Larry?
Larry York, District 26.
KT Gallagher, Dunn County Health Department Director.
Greg?
Greg Quinn, Dunn County Veteran Service Officer.
And then we have with us Wendy Winger and Santana Stoddy, who will be doing a presentation in a bit on the Behavioral Health Crisis Program.
Excellent. Excellent. And Greg, I know you're on active duty, so you need to tell us where you are.
So right here, I'm in beautiful Dunn County, sitting in my office. I'm actually
okay. Then
the military has some travel restrictions, and so I'm doing a course that is. So I've been on MS Teams all day doing a virtual online course, and I got a whole nother week and a half of it. So I get better internet here.
Okay, then I thought you were going to tell us that you were someplace, exotic.
No, I signed up to be there, but they restricted the travel.
Okay. All right. Well, welcome everyone. Item number 3 is approval of the minutes for May 21st. Supervisor Steen moves. Is there a second? Chairman Bartlett seconds. Any discussion? All in favor, say aye.
Aye.
Opposed? Okay. We don't have any items 6 at the request of the chair. Item 7 is Veteran Service Director's Report. Greg, please.
Good evening, everyone. I didn't submit any written report, but I'll go over quickly kind of the activities of the office in relation to some COVID-19 updates. We're still functioning in really a split operations environment. Benefits specialist is teleworking, has been incorporated back into the office 1 day a week. We're still kind of monitoring that. Childcare is a challenge at this point. And so I utilize volunteers still and a work study student to kind of maintain the office. The activities, we're not restricted with any of the activities that we're still doing related to any benefits. It's just an extra step or two based upon the environment that we're in. And we're postured to continue that there won't be any challenges. We're still getting the work done. Again, it's not as efficient as face-to-face, but we're still adjusting and working directly with the public. They're very accepting of that for their own safety as well as ours. So as the new public health guidance come down, we're going to continue operating the way that we've been directed. A few changes as far as some of our partners. I anticipate over the next month or two that the federal side, the Veterans Administration, is going to be opening things up a little bit more for direct healthcare appointments, which there's been a lot more virtual or telehealth appointments. And then on the state level, some of the benefits they've been in a remote environment that's created a few challenges. Just again, the timeliness for some of the things we want to get done, it never as quick as we'd hope, but it's still getting done. So that's kind of as far as the environment. Again, travel is restricted. We have continuing education requirements for our positions. And we've had two of the continuing education trainings have been canceled because they're in-person trainings. So be looking at a different delivery method, but that's going to be up to the associations on how they want to deliver that. Any questions related to that report?
Any questions at all for Greg? Comments? Go ahead.
Then the next thing that I'll cover is the grant opportunity that I'm looking for further support. Last month, I just provided a little bit of a brief on opportunity that came to us through UW Extension office. And we only had like a week and a half to prepare and partner on the grant. So I had attached in the packet the narrative piece for this innovative funding initiative grant. And just kind of in a summary of it, number one is there's no cost to the county outside of in-kind match. The proposed individual that will, if the grant is approved, that'll work the 16 hours is a current work study student for me. So the supervision process of that will just transition into a little bit more formal outside of the work study agreement that we currently have. But ultimately, it's going to create an opportunity where we can do some more outreach. If we look at pre, during, and post, I would say like not incarceration, but probation, parole, as well as police contact, all surrounding substance abuse is going to give us a little bit more of an outreach. But it also is conducting some work in Pepin and Buffalo counties, partnering with those service officers there. And then kind of lastly, there's an education component of that to work with a lot of our partners to give an education on really the military mindset, the military language, the understanding of how some individuals think and operate once you're conditioned in that type of an environment. Sometimes it doesn't always translate into the civilian world as cleanly. And so there's some challenges. So that's some of the pieces with that. And so I'm looking for support from the Health and Human Services Board if the grant is approved. If for us to just get the support to carry that on. I can tell you the budget that was submitted for the total budget was $13,905, and that the most that we could have applied for was $15,000, and that in that budget, that's an average of $15 per hour for 16 hours a week for a disabled veteran. That's who our target is to work in that position. Any questions about what I just briefed on the grant?
Greg, this is Diane Morehouse. The only question that I had, I think you touched on a bit, was how much additional supervision on your part is going to be required?
I would think probably maybe an hour, 30 minutes a week, just really setting up what the intent is and kind of the workload for the week. And the great thing is I'm in a salaried role. So, half hour is a half hour or an hour. The job still has to get done. But it's the greater benefit, those second and third order effects will actually save us time, because currently our ability to get to the jails is limited. We'll have somebody to go to the jail because we're periodically we can't get there to meet with some of our veterans, and we'll have an individual that'll be able to make those contacts with the treatment programs, as well as with probation, parole, and even with CJCC in that event, and with some of the other health and human services programs, that like adult protection stuff. So I see that it'll be a greater benefit, that extra half hour to set the intent.
Yes.
Will save time in the end.
Okay, thank you. Other questions or comments for Greg? Okay, thank you very much. And
Thank you.
Bonnie Barker and Bill Lamb have joined us. Welcome. Bill, you're muted.
Thank you. I was sitting in Never Never Land.
And where is
On
that?
the invitation, there's also a Google Meet. See, on the invitation, there's a Zoom, but there's also a Google Meet, and I chose Google
Oh.
Meet. And see it meet.
That's
Sarah
all
and I
right.
haven't done. We were
You're here
talking.
now.
Yeah.
Welcome. Okay. Supervisor Steen, yes, please.
Do we need a motion regarding this grant proposal?
Well, I was actually going to ask the committee's indulgence if we could move this, it's an action item, if we could move it up.
Oh, yeah.
Yeah,
Yeah, it's fine with
all
me.
right. And then, in fact, we do need a motion to approve the UW Extension Veterans Innovation Grant proposal.
I would so move.
All right, is there a second?
I'll second it.
Who said that? Bonnie did. All right, Bonnie, thank you very much. Any further discussion? All in favor?
Aye.
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 Did you,
Aye.
this is Bill. Did you hear me that time?
Yep, we hear you.
We did hear you. Thank you very much. So the grant is approved. Good luck on this. We'll look forward to hearing about it.
Thank you very much.
All right, thank you. Item number 8, Public Health Department report. KT, you are on.
Thank you. So I wanted to make sure that you guys had everything in your packets, so I don't have to pull them up on the screen as far as our public health funding. We're good there. Okay. So I will start with just following along with the agenda, a quick communicable disease update, and I will give you guys all the data since I know that you, like me, are data nerds, and we'll just kind of jump into a screen share real quick. All right. So what you're looking at is our situational report for today. So these numbers are updated. We have had almost 3,000 negative tests here in Dunn County, and we're still sitting at 29. Right now, we are working 2 contact investigations associated with clusters in both. There's a multi-county cluster that we're working, as well as a La Crosse cluster that we're working. But we have had no increase in positive cases. And so that's really positive. Everybody has been released from isolation, and so we would consider them recovered. This is also something that I sent you guys electronically so that you could find the web resources at home if you care to, because this is a little small and I understand that. But this is a snapshot of Dunn County, and it's from Johns Hopkins. It gives us just a breakdown of not only our cases, but our population, as well as some of the questions that were asked last night about hospital beds, number of ICU beds. That's not actually in Menominee, so be aware that that number is not accurate. It is associated with some ventilator space, but not necessarily traditional ICU bed. And I have had that conversation with our partners here at the hospital a couple times just to make sure that indeed we don't have traditional ICU beds here. And then the numbers, I wanted to just spend a little bit of time on our Wisconsin numbers, but then also our surrounding counties. So like I had shared, La Crosse is having a significant increase. On the DHS website, it's listed at 179 cases. They posted on their social media that they're at 195. They've had an increase of 22 cases today. And they actually are really concerned about some community spread. And so they have shared that if you were at a series of several locations, including 6 bars, that they are asking you to contact the local health department, just trying to get ahead of this cluster of illnesses that they are seeing. Trempealeau has also had an incredible increase over the last 2 weeks. They are working a significant workplace outbreak. And I do believe that they are doing facility-wide testing at this point. So they were at 20 cases just a couple weeks ago. And one big workplace outbreak can really impact that. They're a very small department, and their threshold for working through these. Uh-oh, we're not going to restart my computer. Do you guys see that?
Mm-hmm.
A second. Love technology. Okay, try that again. So they're really working through those 85 cases, and it's a significant burden on their ability to do the contact tracing. Additionally, I think that there's some language barriers with this particular outbreak, which happens, and so that adds time and energy. So that just kind of gives you a snapshot. In this sheet that I had sent you, you can go find the links to all the different things that I'm talking about, since the lettering is a little bit tiny. But I wanted to jump into the metrics. I'm just going to go ahead and present from the beginning. Oops, let's go back to slide 1. So these are the numbers that I follow along, the data that I look at as far as disease burden and trends. And just to give you guys an update, this is from yesterday. I did not have an opportunity to update it today. But I think it's important to know that we have had a bit of a plateau at 29 cases. This is where we are within the region. These dots are not super helpful to look at, but again, this was just a couple days ago. And we are seeing that increase that I had talked about. Barron is also seeing an increase, and Pierce. And so that's that multi-county outbreak that we are working with contact investigations. Also considering a language barrier with that particular case. One of the other things is rate that we look at. So how able is a community to deal with the threshold of disease? And so when I talk about Trempealeau, they do have a significant increase, even though their cases aren't as high as La Crosse, Eau Claire, St. Croix yet. But just looking at the rate is pretty substantial at 271. And then this is the trajectory or trend data that I've talked to you guys about. Where are we seeing doubling rates or ROs that happen very quickly? And so over the last month, so 5/15 through today, we're seeing a couple places with really substantial and consistent doubling. And that is concerning. Recognizing that we're holding pretty flat, and I'm grateful for that. Another thing that we look at again is the regions. Where are we seeing new cases and how many new cases are we seeing a day? So that is in the region going up slightly. You guys have heard me talk about ILI, so that's influenza-like illness. It's one of the state indicators in the Badger Bounce Back Plan. And this is a metric that measures people that present to the ED or emergency department or urgent care with influenza-like or COVID-like symptoms, but don't actually get tested. And so that is also on the increase here in Menominee. And this is Menominee data. We have worked to get that kind of segregated from the Eau Claire data. Testing capacity, you guys have heard me talk about how many people are retesting, and we're trying to hit that 625 tests a week to be in line with the goals that the state have put forward. And that's really to make sure that we know that the cases that we're not seeing are not because we're not looking. And I know that's a lot of negatives, but if you're not looking for something, you're not going to find it. So we don't want to put our head in the sand and assume just because we're not testing that it's not there. And so one of the big increases that we saw over the 27th through the 6th is really related to the state initiative to get baseline testing for all of our long-term care facilities. And so all of the long-term care facilities in the county were tested. And so that really bumped up our testing levels. Now we're back down to about a baseline. And so that we have to do in Dunn County some work to make sure that the folks that are symptomatic are getting tested. It's still not a done deal if you've got symptoms, if you don't have a primary care provider that you can get tested. Even as a tech literate consumer of healthcare, it can still be really challenging to get set up with the right phone number in the right area to get set up with a test. And so that's something that we're actively working on. hospital capabilities. This is another thing that I look at, where in a region, how are we doing on both ICU beds and overall beds? And so this is broken down by the Northwest region. So you can see that we're in the middle of a very large region, and then those beds are reflective of that whole region. And so again, this is a couple days old on the 17th, but recognizing that there was a good amount here in the region of ICU bed space. Daily, I pull up a more granular report so I can look at the hospital bed space in Dunn County as well as Eau Claire and Chippewa, and I'm able to see where we are daily. And right now in our region, we look pretty good. And then this is another metric that you guys have heard me talk about, is whether or not we can do the follow-up really quickly on both disease investigations and then contact tracing. And this is actually going to be part of the metrics in the new grant funding to make sure that we're interrupting that secondary transmission or spread of disease. And so we've got 24 hours from when they upload the lab report on a positive to contact that case. And then we have an additional 24 hours or 48 hours total to follow up with everybody that's been in close contact. And so if somebody has kept their circle small, then we're following up on 3 to 5 people. If they were at the bars, that can be really tricky. So at this point, we're doing just fine. I am working to increase our capacity, surge capacity for case contact tracing with conversations with a couple folks that have reached out to us or we already know for contact tracing. Again, same general public health recommendations. Nothing has really changed. All the same things. This is something that I updated, or rather our public health educator updated. When I talk about changing things incrementally, I talk about turning the dial, and I think that this is a good visual. There is a difference between workplace settings and social gatherings because of that social distancing. So when people talk about shops, big box shops, yes, it can be hard to keep that physical distance, but it's not the kind of place where you're going to give somebody a hug. Well, at least I wouldn't. Maybe you guys would, but typically there is a little more restraint. So that's one of the reasons that we are seeing those openings, and we believe that they are safer than those really large social gatherings where there could be more close contact. So that is an update for COVID in Dunn County. Any questions on that before I jump into some of the current communicable disease infrastructure or funding?
Any questions? Anybody? Supervisor Bjork?
Thank you, Madam Chairman. I was just wanted to jump back to number 4. KT had mentioned as far as our meeting date is how it relates to the county board. Were we going to discuss that, or would she like to discuss that? If should we be changing our meeting date?
Oh, thank you very much, Supervisor Bjork. I skipped over that, didn't I? Yeah, you did mention that last night, KT, that meeting after the board puts you out, both of you actually puts you out 5 or 6 weeks. Any interest in changing the meeting date?
I would find it helpful, but at the same time, I'm not the only department head in this Zoom meeting. So Chris or Greg, do you guys have concerns?
None from me.
A question.
Oh, Sarah's raising her hand.
Well, isn't the county board meeting late in July? I thought they said it
is.
wasn't until like the 20.
Yes, it's the 29th of July.
Make a difference.
Well, the July meeting is the 16th, but it's not just the July meeting. It would be meeting schedules going forward, if I'm not mistaken.
So we used to meet the fourth Thursday. And then I know that we changed in part, Larry, because you had a conflict because there were certain days that you were unavailable because of your work. So I'm not sure if that remains a conflict, but otherwise, I don't know that we're tied to Thursdays or a particular week of the month, but I know that we did change so that we could accommodate Larry's driving schedule.
Go ahead, Larry. Supervisor Bjork.
2 points there. I'm ready to retire, and what KT is dealing with is much more important than I'd find a way to make a meeting if I could. And also, I thought another good point that was brought up last night with the return of the students, we need to be nimble, if I would think. So it's, I would really think we should just follow the lead of our department heads and what they want to do. But I mean, it's a pretty big point. If you have to wait 4 to 5 weeks after the committee meeting before the board could act on something, it's a big deal.
So if I can be selfish, I would appreciate if we could move earlier in the month so that we had a different cadence. But it's not just me that's impacted.
Chris and Greg, you want to weigh in?
Well, I would just do the math backwards a little bit as to when that could possibly be. So if we wanted to meet earlier in the month, but allow time for an action to come forward, it would have to be before executive committee.
Right.
Which is the second Wednesday, I believe.
Correct.
And so it would have to be actually noticed for executive a week before that. So now you'd be the first Wednesday of the month, would be the earliest. And then so I would say that would be like in terms of keeping with the noticing timelines that have been set forth, that would be really early. That would be the earliest that it could be. Now, what I would say is the other complication then that comes with that is that don't know that there's anything sacred about the first week of the month or the last week of the month or any week in between, except that you will not have good financial data in the first week of the month.
Right.
You just can't pull it together that quickly.
Is there any sentiment about moving the meeting up to the first week of the month, understanding that our financial data might not be as good as it could be later in the month?
If I could speak, I would say you might be just as it might be just as advantageous to actually move to the last week of the month, which is either the 4th or the 5th week, depending on how many weeks and what day of the week that you meet in a particular month. But then that would allow you to have good financial data. So if you met at the end of June, you would have good financial data through the end of May. And then you would have you'd have about a week's time until you'd have plenty of time to get on the executive committee agenda and then in front of the board in the middle of the month, in every month except July when there's not a meeting until later in the month. But otherwise, so it would create about a 2-week wait to county board instead of a month or a little bit more.
This is Bill. That makes sense to me.
Okay. It actually does to me too, as long as it works for our department heads.
Right.
And also for Chairman Bartlett. So shall we move to that? I don't have a calendar in front of me, so I don't know if anybody does. So we would, instead of meeting on the 16th, we would meet on the
30th would be the last Thursday. in July.
Thursday.
It happens to be that July has 5
5
weeks. Mhm.
weeks.
So it'd be-
We could put a schedule together, but
Yep.
July 30th. Yes, Chairman Bartlett.
I would suggest if you're going to go with the last Thursday, to go with the fourth Thursday. It's simpler for people to remember, and it's simpler for the public to keep track of when a meeting is, instead of saying the last Thursday and then switching a couple of months.
What's the fourth Thursday, Chris?
the 23rd.
The 23rd?
Mhm.
Objections? Anybody?
I mean, it will be a little wonky for July anyway because of
Right.
the county board meeting then the
Right.
following week. But then when you get into August, you would have a meeting then at the end of July, and then it would resume the regular schedule. So executive committee would be so the county, we would meet on the 23rd, executive committee would meet on the 12th, and the county board meeting would be on the 19th.
Right.
There's no county board meeting in August.
In August.
Right, okay.
But there is an executive committee meeting, right?
There is.
Yeah. Without objection, we can put a schedule together. So moving meetings to the fourth Thursday of the month. I'm assuming at this time also 5:30 still works for everyone. We did talk about that last month. Okay. And thank you very much, Supervisor Bjork, for catching me up in just sliding right over that.
Anytime I can help.
I appreciate it. I appreciate it. KT?
Sure. So let me jump into Wisconsin COVID-19 update. So things that you guys need to be aware of is that we are working with school districts quite closely to get them back up and going. And so DPI, Division of Public Instruction, is set to put out some guidance, long-awaited guidance next week. And that we also have guidance that was embargoed that we saw today that I think that they've actually made public now from WIAA. So that's the sports oversight organization. So for folks that follow high school football, which I hear is a thing here, then there's some guidance for folks that are coaches and ADs and that kind of thing. And so I have a meeting, all of the health officers have a meeting with all of the superintendents throughout the state tomorrow. Monday. My days run together. And we're gonna discuss the guidance as it goes out. We're having local conversations about implementation and harm reduction for school districts that are moving forward with things that are maybe a little higher risk, like weight training. So that's going on. At a statewide level, there was a little bit of a shakeup in some of the administration, and I think you guys may have heard that we have an interim health officer for the state. The previous health officer was asked for her resignation, but we don't have any more details on that. And so the current health officer is somebody who led the Bureau of Communicable Disease, and so has a long tenure in state public health and a long tenure in great education. So she's already been much more accessible and clear with some of the work that they're doing and keeping the locals up to date. The state is also with that transition, they've been really more intentional about bringing locals into the conversation as early as possible. When you have 72 local health departments, including the cities and the tribes, I think we're up to 75, I'm sorry, numbers are hard. There is a great degree of difference between what the state thinks is going to work and what local implementation thinks would work better. And so with that transition, they've been much more, and health officers and staffing, much more intentional about bringing in local perspectives, and I'm grateful for that. We do believe that there will be a data portal So all of the data metrics that I pull and look at separately daily, the state is going to start putting that on their website in a way that anybody can follow along with. So I think that's going to be really helpful. Many of our local counties in the region have actually developed something independently, waiting for the state to get that put out, and do have their websites updated to have a dashboard of sorts. And we are in conversation here in Dunn County whether or not to just link to the state or to try to replicate something here that's maybe a little more, not only with just the colors and the shapes, but maybe with some meaning behind it. So that's in process at a statewide level. Statewide level, you know, you've heard a lot about the long-term care facilities. So that was that state initiative to get a baseline test. They've moved through that. They will continue to test staff every other week is what they're currently recommending, but that's obviously subject to change and availability of tests. There is some conversation about testing all DOC, the Department of Correction prisoners, so in prisons, to see again in that congregate living situation if they have anybody that's positive. And so we'll see that come through. And then additionally in the state, we're really looking at implementing some of the strategies that are being promoted with some funding. And so with that, I'd like to talk through the packet that I gave you guys, because I think that that's important. So that instead of the state holding the funding, which is really what I think was, and they had intended to happen when we had a more statewide approach under the Safer at Home order, when that was nullified, then we have had just a fair amount of dollars pushed our way in a fairly quick time frame. Not fast enough, obviously. It could have been here 3 months ago and I would have been really happy. But so the COVID CARES funding, you have two things in front of you. One is just a breakdown that we worked on to help us manage the dollars and where it's going to be allocated, what it's going to look like in SAP. But I think that that's really nice and clean, because you can see that we've got a little over $500,000 that is slated to come our way. And I think that that number is important. You also see that there's different funding streams, different strings, and different timeframes on all of those. There's only one funding source that moves into 2021. And so the intention is to not touch it this year, but then to actually use it and build it into our 2021 budget to help some of the contact tracing and staffing that's going to go into COVID response, because I'm fairly certain that COVID is not going to be gone by 2021. And we do need to have funding to continue the work to do contact tracing and disease investigation. And so we'll put that off. Local testing. So that next pot of money is not for the health department to do testing. What it's for is for the local health department to coordinate testing for folks that can't get it. Meaning, from a community perspective, are there populations, say work sites or congregate living situations, or underserved populations that really struggle getting a test? And so it's our job, we're designating or dedicating staff time to make sure that we can iron out that process. I don't know if anybody in the room has tried to get a COVID test, but I have a family member that has. And even as a very digitally literate person that is a comfortable consumer of healthcare, he really struggled. And so we want to iron that out for folks that maybe aren't so digitally literate or aren't really sure that they're in the right place and they should be getting tested, instead of having a family member that's, you know, shaking their fists at them like I did. So we want to make that a little bit easier for folks, and we're going to use that position to make sure that we can get everybody that needs to be tested, again, if they're symptomatic, or even if they've been in close contact with a known positive, since the CDC just put out some new guidance yesterday, 2 days ago, about testing asymptomatic folks, that they can get tested. And then that next pot of money is a straight 30 grand. And that's for work that we've already been doing to update our public health emergency preparedness plan to bring it up to date, I think you guys heard me talk about how our previous FEP, as we lovingly call it, didn't have my name in it. Some of the superintendents had left this world. So we really did have an opportunity to update with the most recent contact information as well as planning capabilities. And then the last pot of money, that's the big one. But I want to talk through all the crazy strings that are attached to that money, appropriately so. So these dollars are really meant to compensate for contact tracing, disease investigation, and disease monitoring. And it's based on a state metric that I really hope never comes to fruition. They looked at our worst case scenario, what they thought we could be faced with. And then they talked about how many FTE would it take to do that work. So with their metric, they are showing that our surge capacity, what the health department would be required to follow up on, is 52 cases a week. That gives me pause. So it's really, I really thought the light wouldn't go off if I was standing. All right, guys, sorry. With 52 cases a week, that translates to 10.5 FTE. Right now, I have about 5 FTE, and of course, we don't have any problem doing the work that we need to do. But if we were to basically have double our total cases in a week that we do currently have now, that would really, really stretch us. And so this is only, we can only pull down what we actually use. So it's based on the number of cases, and it's based on the number of hours, and it's based on an expected salary for those contact tracers. And so while they say that there's $382,000, that's really going to be dependent on whether or not our first wave of infections really warrant that amount of work. But I think it's important to know that they recognize that local health departments are doing all COVID all the time, and they really are trying to fund that in a meaningful way. And I'm very, very appreciative. The other document you have, so the big long one, does talk a little bit more about the specifics of it. And I think there's some more details in there. And again, I don't want to belabor any of the details, but I wanted to see if you guys had any questions on any of that.
KT, I do have a question on that document. I just was looking at plans and budgets and reports due. You've got some fairly significant due dates in July. Is this how much of a hardship is that going to be?
So I don't think it's going to be much of a hardship. So they are working on templates for those plans, and like I had shared, our FEP has already been updated to reflect our current reality. It's a matter of tucking in the things that they think is really important that we need to address in that plan, specific to COVID. So we've already updated our point of dispensing plan. So if we were to have an effective treatment, or if we were to have a vaccine, we could make sure that all of our MOUs are in place, all of our plans are in place, but they may ask that we add specific language. And so we're going to take that template on the plan, and we're just going to tuck in the things that they think that need to be updated. I don't think that that's going to be a really difficult lift. The other reporting criteria, many of it is coming out of WEDS, which is our Wisconsin Electronic Disease Surveillance System. And so again, that's not a substantial lift for us because we're already putting that data into WEDS. And it's a matter of putting it out there. They're crafting new reports for us, and we'll be able to pull it and submit it. So it's not going to be too burdensome. The other thing is we have been time tracking through our electronic medical record system since March. And so we are going to be able to report that to CARS, which is the contracting, I don't remember what it stands for, but it's basically the state financial system that they hold the money, we bill against them, and then they reimburse us money. I'm sure that Sarah Stabenow could really clean that language up for me. But that's the gist of it. So that reporting is not going to be too terribly cumbersome. We need to be above board. We need to make sure that we're only pulling down dollars for work that we're doing. We need to be very careful not to supplant. And these are all things that are very much on my radar.
Other questions for KT? Okay.
So that's public health funding. You guys will see that come through in a budget adjustment at our next meeting. It came through, if we had hustled, we probably could have gotten it properly noticed, but I didn't want to rush that process. So I really do appreciate the ability to be a little flexible with that. The other thing that Supervisor Morehouse and I had talked about getting a quick overview are some of the system constraints. And so we had talked about WEDS as a system constraint. We had talked about how this system was really meant to follow a low level of communicable disease associated with things like whooping cough, measles, chlamydia, all of the diseases that we have at low levels within our community that we follow up on. But we're seeing the use of this system just logarithmically go up. And so it's really had some incredible lag. It's had some real struggles. And so they are actively talking about updating the infrastructure to meet that demand. I think anytime you have a state system that's updated mid-use, it's concerning. But hopefully we do have a product that doesn't leave us with any downtime and is better in the long run. So I think that's one of the things that we were talking about. And we were talking about the funding that communicable disease follow-up is an unfunded mandate. Right. Previously, we had about $16,000 come to support the work that we do for about 2 FTEs in communicable disease follow-up. They're making that right with the CARES funding and with the state pass-through of those federal dollars. But previously, it is something that we just did not have infrastructure for, and that's why we're having to ramp up so incredibly.
And it isn't necessarily likely, I assume, that the current federal dollars will continue.
So we can be hopeful. And I think those of us that remember 9/11, there was a continuation of funding for a couple years. And so my hope is there will additionally be funding through the next year, but I'm being very careful about the dollars that move forward. So we have some emergency preparedness dollars. They basically gave us a double allocation. And that grant cycle runs through, it's June to July. So we'll have additional dollars that'll run through July. But the only thing I have in writing takes me through July of 2021. I don't have any written indication that there will be dollars to help offset the work to do contact tracing and disease management after June of 2021.
Anything else? Other questions for KT or comments, observations? Nothing? Okay. Financial report then, KT?
Yes, so you guys have 3 months of financial reports in front of you. Super exciting. So not exciting. But what you'll see is that because we're all COVID all the time, there's been a real offset in our program generated income. And I mean, that's appropriate. We're not doing the TB screen test necessarily. We're not doing the STI checks. We're not doing the work that we would normally bring income in for. And so the CARES funding is really offsetting that, recognizing that we're not doing that work. I do want to share that this month, our environmental health has started licensure. So we see the bulk of our environmental health PGI this in July. And so that number is not concerning to me, but reproductive health is incredibly concerning. and PGI related to the prenatal care coordination that we do and the community health clinic that we do is concerning. But we really don't have a choice to not deal with COVID. We really do need to reallocate that staff time to do the work.
Any questions on the 3 financial reports that were in our packet? Okay. Thank you very much. And thank you for all the work that you've been doing. I hope you understand how much, and I'm sure everybody in the committee shares our appreciation. Yes, Chairman Bartlett.
I thought of something with your meeting date, and I think your date would work fine. But when we get back to meeting in person, admin meets the same day. So I think with some communication with admin, maybe they could move up a half hour. You could move back a half hour and still, because I know the goal someday is for everybody to meet in room 54.
Yeah.
And so I'm just throwing that out there. I don't see a problem. I would think you could work it out, but I wanted to make you aware of that. You might want to have a discussion with Vaughn and see if they can move up a half hour, and maybe if you have to move back a half hour, but that would be it.
What time does admin meet?
3:30.
Chairman Bartlett?
And you know, if it ends up being a 2-hour meeting, it's going to be pushing it for you. So if they could move up, I just thought I'd throw that out there. I thought of that.
Yeah. It's never as simple to schedule a meeting
No,
as
it isn't.
think, is it? Okay, anything else for KT? Thanks again. Item 9, Department of Human Services staff report. Chris.
All right. Well, I'm just going to use my time this evening to not say much of anything and to allow 2 staff from our agency to do a overview of our crisis programming, and then a little bit of information about how COVID has affected or not our crisis programming, and then answer any questions that you might have. So Wendy Winger is the one of the behavioral health services managers, and Santana Stoddy is the crisis program coordinator. And so I will turn it over to them. Oh, except that I have a thing for them.
Are you going to share it, Chris? I bet Santana could too.
Do you have it up, Santana?
Yeah, I do.
Can you share it? Okay.
I will try that out. Let's see.
Nice job.
Good?
Yep.
Okay, perfect.
Do you want to move it? Do you want to move it? Yep, slide view.
Yes, I will do that. Oh.
Okay, so Santana and I had a deal. She made the PowerPoint. I'm going to present. My name is Wendy Winger. As Chris said, I'm one of the behavioral health managers. So we wanted to just share a little information on the emergency mental health crisis services that Dunn County provides. You want to switch slides, Santana? So mental health crisis, what is it? In the state of Wisconsin, we're required to have a mental health crisis program. And when they define what crisis means, that's the definition straight from the statute. It really can be anything. A lot of times it points to mental health, but it could be someone's having a tough time caring for someone, and they're not able to do that with things that they have. Or that last sentence, by the efforts of those providing ordinary care or support for the individual, it's creating a crisis because they're not getting what they need. Next slide. So this is our crisis program here in Dunn County. The majority of this is mandated by DHS 34, the statute that governs emergency mental health crisis here in the state of Wisconsin. We have a 24/7 telephone crisis line. We contract with Northwest Connections for that service. That's the telephone number. The statute mandates that someone needs to answer that telephone call live and in person. We're also mandated to have a mobile face-to-face response. In Dunn County, we have 8 hours per day, 7 days a week. It's 4:30 p.m. to 12:30 a.m. that we have someone on call. And if the telephone staff determine that they need a face-to-face, someone really needs that not hands-on, but just someone in person to help de-escalate or to see things differently, to assess, they can dispatch someone face-to-face. We also have in our county that if law enforcement requests a mobile response, that person can be sent just at law enforcement request. And it is just those 8 hours. Was there a question? Walk-in capability. What this is at Human Services, if someone were to walk in distress, or anyone in the building, or if Northwest Connections during the day needed a face-to-face assessment, we have someone capable, on call, able to provide that resource and that assistance. The biggest thing is follow-up and linkage. I shouldn't say the biggest thing. This is Santana's entire job, or the majority of Santana's job, follow-up and linkage. So anytime that someone has contact with our crisis services, be it Northwest Connections, telephone, mobile, or walk-in services at the county, Santana gets the report and she assesses what kind of follow-up and linkage to complete. It could be telephone contacts. It could be a lot of times connecting folks with resources. And during those contacts, she's assessing safety and intervention. There are times that we call someone the next day after a crisis follow-up, and we're doing a welfare check, just assessing. Most of the times, though, she is providing support in figuring out how do we help them if they end up or come into terms with a crisis again. Her follow-up and linkage also includes follow-up to the hospital. So if someone goes to the hospital on a voluntary basis or involuntary hospitalization, Santana also does the case management and follow-up related to that while they're in the hospital and after. We also have stabilization services in Dunn County. The base is stabilization calls. So a lot of times the calls, we can find someone in mental health distress benefits from the support of others. There are many times that these people in crisis maybe feel like a burden to others or alienated themselves, something to that effect. And so if we can connect them with natural supports for stabilization calls, or Northwest Connections will provide those stabilization calls, that's one form of stabilization. Another that we have in Dunn County is crisis beds. We have actually 3 providers in Dunn County. Arbor Place right in Menominee. Aurora is a crisis bed in Chippewa County that we share with a few other counties. There's 4 beds. Arbor Place has 1. And then Positive Alternatives, they have 3 different sites. One in Menominee, one Polk County, and one in St. Croix County. Is that right, Santana?
Yep.
Yeah. And each facility or each location has a different number of beds. The one in Polk County is only for females. Positive Alternatives is for 12 and up. I think we're done with this one. Yep, you're okay. I've got to move your picture here, Santana. What do services look like in Dunn County? So just a quick summary of what that looks like. So we contract with Northwest Connections for the majority of these services, both telephone and mobile response. Northwest Connections or Dunn County, if it's a walk-in, right away, if someone calls the crisis line or walks in, risk assessment is completed. We figure out how to safety plan, provide support, and provide information on resources and referrals. A lot of times, many times, if law enforcement is calling for assistance, we collaborate with them to determine what to do to best help this person in crisis. Per Wisconsin statute, we have to look at least restrictive options, and the police are trained in that as well. Internally, as we've identified or introduced Santana, a part of our crisis service is Santana's entire role. She's the crisis program coordinator. And then we have Santana, Ruth, and then a half position. I should say Santana provides 100% crisis linkage and follow-up. We have Ruth, who is our commitment case manager. So she follows anyone who goes through the involuntary mental health law process, and they are ordered to a commitment order. Ruth follows those folks or case manages those. And then we have a half-time position who is Madison, and she assists Santana with some crisis follow-up, and she also case manages some commitment orders. These are the tiers of intervention. I always find them very interesting when I'm thinking of crisis services and when we have calls from folks who are concerned for individuals in the community, maybe demonstrating mental health concerns. We have to look at all interventions, all tiers of intervention prior to doing an involuntary hospitalization, starting with, is this person able to be at home individually? Could we do something with those crisis stabilization calls? Could we engage a support or family to help them in their home or even at someone else's home? Voluntary hospitalization or detox, crisis stabilization, which actually I would put crisis stabilization before voluntary detox or hospitalization. And then we have 2 involuntary holds. Wisconsin looks at alcohol a little differently. If someone is so incapacitated, they're not capable of caring for their own needs, or we're unsure if their risk is due to alcohol intoxication, police can utilize something called an incapacitated by alcohol hold. That's a 5145. This one's a little bit tough because hospitals don't like a detox hold, but sometimes Mayo Red Cedar or one of the hospitals in Eau Claire will allow someone in their emergency room to be medically treated for detox. The 5145 is only as long as the treating doctor determines. So a lot of times someone who is incapacitated by alcohol can sober up and get to maybe a less blood alcohol blood alcohol content. And in reality, that's probably their highest risk. So that one, it's helpful, although I think we could use some work on the incapacitated by alcohol hold as a bigger state. And then our involuntary hospitalization hold is called a 5115 emergency detention. There has to be criteria met for this. There has to be dangerousness that is imminent, and there has to be symptoms of mental illness being present. To approve an emergency detention, you have to have criteria, and it needs to be approved by both law enforcement and Dunn County Human Services, or someone that we've given that role, and we've given that to Northwest Connections. Next slide, Santana. Who can utilize the Dunn County Crisis Services? Anyone. We listed the common callers of our crisis program in 2019. Our highest caller is a person who calls the crisis line independently for assistance. Police are the second caller. As we just talked about with an emergency detention, it's a collaborative effort between police and human services. So police are calling whenever someone's in mental health distress. If they need assistance, they want a crisis assessment, and or they're thinking it's an emergency detention. The third caller is providers. That could be any of those noted: hospitals, therapists, school counselors. Friends and family are the next, and then schools or academic facilities, including UW-Stout. A look at 2019. So here's some numbers. Statistics, in 2019, we had 1,142 total crisis calls. To break this down, there were 1,066 telephone crisis calls. And of those, 62, they dispatched a mobile face-to-face response. We also had 10 face-to-face crisis assessments at Human Services. And then we had 4 video assessments. And this is pretty cool. We implemented we utilized a grant to implement video telemedicine capabilities into our crisis program. This is very much underutilized and something that we hope to increase, and we're in that process consistently. Age of the callers or the crisis contacts, we had adults 914, and then under 18 was 228. Of these numbers, we like to look at emergency detentions, these involuntary hospitalizations. There were 100. Of those 100, there were 80 adults and 20 adolescents. Of all of these 100, 27 new commitment orders came out of these. So it's 27% of the initial emergency detentions concluded in a commitment order or something called a settlement agreement. It's always great to note the crisis bed utilization because these are community resources. We keep the person really close to home. It's less restrictive. We utilize Arbor Place for 6 people were able to utilize Arbor Place. 3 utilized Aurora in Chippewa, and then we didn't have any positive alternatives utilizations in 2019, which I hope that increases as well. What are we seeing in relation to COVID? During the months of March, April, and May, our call volume has decreased. If you compare 2020 to 2019, decreased about in March, 14 calls. In April, pretty significant decrease, 44, 54 calls, and then increasing a little bit more in May there. I would say on the commitment side, we've seen an increase in acuity of mental health symptoms. And we have the ability when someone is on a commitment order to utilize the commitment order when someone is in need of hospitalization and they're not willing to go voluntarily. We can utilize the commitment order to move them to the hospital. It's called the move to more restrictive. We've seen an increase in that need. Trends that we're seeing in relation to COVID-19, we've seen a decrease in daytime assessments, which seems obvious because we're not in the building and people aren't walking in. We've definitely seen an increase in mental health symptom acuity, which I just talked about. We've also seen an increase in move to more restrictive needs. This slide has a lot on it. I've been doing mental health crisis for quite some time. And we always get the question, this person needs to be committed or you need to do something for this person. And it's really hard. We've tried to notate sort of Santana and my thoughts and experiences on just the positives and obstacles of mental health law. And I'll run through these quickly. Positives, people are they get to be independent based on mental health law. They can do as they wish until there's that imminent risk of dangerousness. Mental health law can assist someone in getting past the dangerousness and back to their baseline. So if we do need to intervene, it will help them be safe. The community is safer when there is an intervention. So that mental health law gives us an intervention, a capability to intervene. The next one's more about commitment orders. Some people really do benefit from being prompted to do something. Some people are rule followers. Mental health law, if commitment orders are implemented, it provides case management and follow-up to assist people in navigating the resources, even just mandated by the crisis statute to engage in follow-up and linkage. Mental health crisis gives support outside of the hospital. And I really do think that Wisconsin mental health law is moving in a more progressive, humanistic manner. The implementation of the least restrictive intervention was probably only, I would say, 8 years ago that occurred. Obstacles that we've seen, not all folks are rule followers. We know that. Mental health is not black and white, which can be really frustrating, and it can take a while to determine appropriate treatment for folks. Laws aren't gray, particularly mental health law. For example, there has to be imminency to utilize an emergency detention, but it's not defined. So imminency is really relative to what's happening for that person. We have a lot of conversations on our unit on how do you force someone to engage in mental health services. So we can do an involuntary hospitalization. There can be a commitment order, but you still can't force someone to go to therapy and talk about what's going on. You really, if you can force someone to take medications, but I'm not sure that that's a really good way to build insight, awareness, and just really, I would say, personal growth. So that goes hand in hand with the next one. How do you create insight and awareness if the person really isn't in reality or isn't capable of doing that? I would say a big law of mental health law is it's very reactive, not preventative or proactive. You almost have to do something or be showing something for an emergency detention or an involuntary intervention. And then you have to have specific criteria regardless of concerns. So there's a couple of points here. There's a lot of personal beliefs and stigmas on how one should live and how mental health should be managed. Dangerousness is a perception. We see that a lot with psychosis. Alcohol and drugs are a way different animal when it comes to mental health law and when there's dual diagnosis. And a big one that I learned as a young crisis worker is that hospitalization isn't always positive. Sometimes it's bad to take someone out of their community. And so you have to really assess and determine what is the best intervention to ensure safety. That is all we have. Listed some important numbers that we thought were just noteworthy. There's Northwest Connection, Santana's number, my number, and then the Access Worker for Dunn County. If there was ever a request for a crisis assessment, that would be the number that a person would call, share with the front desk what was going on, and they would connect them with that immediate access worker. Any questions for me or Santana?
Any questions or observations?
This is Bill. It was a great presentation. I checked my email right before the meeting and I saw there was a couple of attachments, but it was on my phone, so I didn't open them. Were they by chance your slides that you just shared, your PowerPoint? If not, could I get that?
Yes. I don't know if Chris had sent it out. Chris, could you send it? Do you want me to just send it to everyone?
Nope, I can send it. Yep.
Okay.
No, I did not send it out. But we can send it out.
Thanks.
Yeah, thank you.
Thanks very much to Wendy and Santana and to all of you for being patient. This notion that we need to learn more about the really important work that our departments do. This is a helpful presentation, and I appreciate it.
Definitely.
Thank you. Thank you both.
Yeah. Thanks for having us.
All right. And then in the full abdication of my responsibilities to speak, I'm going to pass on the financial update to Sarah Stabenow.
Hi, everyone.
Hi, Sarah.
Everybody got the financials in your packet? I'll just go over the last column, which the titles got cut off. That's our projected 2020. So it starts with our grand total of $13,323,14. That's our projected. If our expenses continue to go the way they are, that's where we will end up. That includes salary and operating, and it's broken down in the next two cells below. Operating, we're projecting at $8,275,156. Our salary is $5,047,857. Then there's just a checkpoint that those balance back. Then our budgeted expenses are just the follow down, and our budgeted revenue is coming in at $9,388,703. If everything continues the way it is with revenue and expenses, it looks like we will use $3,934,310 of the $4,096,708 of county levy.
So we kind of usually do the math for you, but I think that's about $165,000.
The $162,398.
There you go.
Supervisor Steen, any questions?
No.
Oh?
No.
Any other questions? Thank you, Sarah. This is clear and very helpful and reassuring.
Great, thank you.
Thank you. Anything else, Chris?
Not under our report. Oh, sorry, I do have one really brief thing. Only because you're going to see it come forward in a different way. So we have had we've had a longstanding position title in our agency called psychiatric social worker. Those are the people that are essentially doing therapy or supervision in our agency. And we have made a request because in Wisconsin, in order to use the title social worker, you have to be licensed as a social worker or certified as a social worker. And so we've been sort of wrongly calling people that. And so we are actually brought forth, HR is going to bring forward a name change to that position. It changes literally nothing else about the position except the name, from psychiatric social worker to licensed clinical therapist. And that will go to the Committee on Administration, which deals with those personnel related things. That will go to the Committee on Administration at their next meeting, and then ultimately come to the county board for final approval of that name change. But it didn't have to come here because it goes to the Committee on Administration. So but I wanted to let you know that, because you'll see it come forward and you'll say, why didn't it come to us? But because it didn't have to.
Okay. Moving on to action items, review of the June 2020 DHS vouchers paid. You have those in your packet. Any questions, anything to particularly note, Chris or Sarah? No?
I don't believe so.
I need a motion to note review of the June DHS vouchers paid. Supervisor Steen, Supervisor Bjork for the second. Any discussion? All in favor?
Aye.
Aye.
Opposed? Note review. DHS annual report, which you also have in your packet and looks very nice. We'll need, first of all, Chris, is there anything that you would like us to particularly note?
No, it's the same format as it always is. You can compare them from year to year. They're out on the web page. If there are any questions, I would be glad to answer those, but otherwise it should be pretty self-explanatory. And it goes to the county board in July.
It goes to the county board in July. So we'll need a motion to approve. Supervisor Steen, and a second.
I'll second.
Supervisor Cromrie, thank you very much. Any discussion? All in favor? Aye.
Aye.
Opposed? Report is approved and it will be on the county board agenda in July. And finally, there is a DHS budget adjustment, which you also have in your packet. Long, pretty self-explanatory, I think.
Yeah, what I would just say about this is this the start of some of that of the COVID monies that are coming through. They're a combination of two things. One is that, so we have a fair amount is exaggeration. We have some funding that comes to us on a federal fiscal cycle, which is October 1st to September 30th. Because of COVID, some federally funded things that are pass-through money across the state are being underexpended. And so some of these things, while they're not directly COVID titled, they're a result of underexpending by counties. And so then a request goes out, if you want more money, throw your hat in the ring and we'll send you more money. So for instance, that was a way that we were able to receive an additional $21,850 from our substance abuse block grant and mental health block grant on the federal level. And we're using it totally for technology. So it didn't come specifically saying it was COVID money, but it's underspent because of COVID. And then the rest of probably the greatest representation in this list are, there's been a lot of funding related to the Older Americans Act for the senior nutrition program to be supportive of the Meals on Wheels home delivered meals program. So there's a lot of money in here related to that. And then some of them are just some of the little basic tweaks that we have to do on a regular basis as funding allocations change.
Okay, any other questions or observations? Supervisor Bjork? I'm sorry.
Yes, question for
Please.
Chris. Does she have any comments about what conflicts that they're having in the Eau Claire Human Services Department with their problems? I mean, it is, you know, what are we to read about, or what are we to think of that, and how are we not having problems like that?
Supervisor Bjork, can we act on the budget adjustment first? Yes? All right, I'll need a motion to approve the 2020 budget adjustment. Supervisor Steen, is there a second?
I will. This
I'll
is Bill.
second.
Bill got in first, a second by Bill Lamb. Any additional discussion? All in favor?
Aye.
Opposed? All right. This will go to County Board. Now, Supervisor Bjork, your question about Eau Claire, and it's a question that I've also had spent some time having Chris explain to me.
So I think that there are a few things that are at play in that, in the situation in Eau Claire. One is that for many, many years, there was either this is my opinion, but that held by several of my colleagues, there was a lack of leadership on the DHS level in the Eau Claire County Department of Human Services. Then for some years, there was what I would call maybe a more detached level of leadership, not necessarily super connected to the actual workforce and work being done. And then about, I'm not sure how long their current director's been there, is probably 5 or 6 years. The last director retired, new director came on board. She has spent, in my estimation, she's spent a lot of time cleaning up sort of the leadership piece of that organization. So she came into kind of a house that was a mess. Lots of kids in placement, no adult mental health services. They had a very small mental health contract with an outside agency to serve their people that were on commitment orders. They had no psychiatry, no therapy, just a very, very, very small program. And so they've worked hard to build some of that infrastructure that had been lacking for a lot of years. But the difficulty about doing that kind of program change is you have to double fund. You have to fund the crappy work you've been doing. And that's a terrible way to say that, but the insufficient work that you've been doing, you have to fund that while you build new programming, and that's expensive. And I think a huge piece of this is the brunt of that kind of a cleanup. We had a similar situation in Dunn County, not related to a lack of leadership per se. It was related to leadership turnover. In our Family and Children's Services section, when I came here 20 years ago, we had spent $1.5 million in the previous year in out-of-home placements. But there had also been 4 Family and Children's Services supervisors over a 2-year period of time. And so there was, in that lack of leadership, or in that lesser than sufficient leadership, that void, people do, they don't have someone to cover their back. They do what they believe is safe, and they spend money. And so I think a lot of it's that cleanup and the double funding of fixing an old, somewhat broken system, and then building a new, better, funding an old broken system and building a new, better system. And then the other thing is that, so you all have heard for a long time about comprehensive community services until you kind of probably were sick of hearing about it as we've added staff and grown. And that we built that program over now a 5.5-year period grew from 1.2 staff on our part to about 15 or 16. So that program has taken off hugely, but we do that as a part of a 8 or 9 county consortium across the Western region. Eau Claire and Eau Claire and St. Croix and Barron County do it in a different model. It's called a shared services model, but it looks different than ours does. And they're only about 2 years old in the delivery of those CCS services. We learned a lot of really valuable, hard, and expensive lessons as we started out, but we started out really small because we had 1.2 people doing the program to begin with. So the expenses or the lessons that we learned were really hard, and they cost a lot of money for us, but it was all relative to the size of our program. We had a very small program. And as we've grown, we've gotten so much better at knowing how to manage and run that program. Eau Claire didn't have mental health services. So when they opened their doors, I believe they hired either 30 or 40 staff for those mental health services about 2 years ago. And then they were just blown out of the water in terms of the number and the need of people that were looking for publicly funded mental health services. And so I think that they're learning some of the same lessons we learned, but we learned it on such a small scale, and they're having to learn it on a huge scale. And I think it's very, very costly. So I think part of the reason why we don't have that is because, of course, we've had stellar leadership for all of these years.
Of course.
Yes. No, I think we've had stable leadership for the last many years. And then we also were able to grow some of that expensive behavioral health programming from small to larger over a longer period of time, and they've just been kind of blown out of the water by it.
Supervisor Steen.
Yeah, Mr. Chairman there, or Chairwoman, I think I fell asleep at the switch here. I got a question for Sarah Stabenow.
Yes.
I asked you.
Yeah, I know you did, and I was dumbfounded that you did, so you caught me off. Sarah, in your estimation, how big of an effect has COVID had on our budget, or hasn't it had any, or did you factor it in there? And if we didn't have the COVID, would our budget be appreciably different?
It's hard to tell. Like the budget adjustment that's coming forward, that's $220-some thousand coming forward just to assist with some of the things that our Meals on Wheels is going up, like Chris had said. Some of the other things are going down. Nobody's going to training. Nobody's going to seminars. There's no hotel stays. So those things are coming down because everything's been canceled. So it's a wave either way. A lot of, like Wendy had said, the services, people are not coming in for therapy. Everything's virtual. We're saving some costs there. Our mileage and travel, nobody's doing face-to-face travel. So there's no mileage expense, which some of those mileage checks, if you guys have looked through the expense reports, can be pretty big when they travel from Menominee here up to the north to be in Dunn County. So it's hard to put a number on it. I can certainly put together a comparison of where we were last year, this time, and this year, and present it next month.
Well, if it wouldn't be too much trouble, that would be interesting. And this is for KT and for Chris and for you, Sarah. Do you, Chris and KT, do you feel that we will come out all right as far as recouping the money that we spend for COVID budget-wise? You follow what I'm saying? Yeah.
I mean, I can speak to that from a DHS standpoint. I think that we will have that it'll be a wash for us. I think where we're saving money in some areas, maybe spending more money in some other areas, receiving some additional funding, a lot less revenue in some areas because of services we're not able to provide. So, but I think it appears like it'll be pretty much of a wash, at least at this point in time.
A final question then. Do you feel, generally speaking, we're 2-3 months behind on where we're at on the money, although Sarah does a great job keeping us up to date. And I'm really happy that we've made that change. Do you think that there'll be a lag concerning COVID money, exceeding maybe the 2 or 3 month lag time carrying over to next year? Is that too soon to hazard a guess?
If I can speak to that, I think there will be a lag. The state and the feds are still trying to figure it out. And we're also still trying to figure out how long this will last, how long we will be social distanced, if our staff are off-site, on-site, when everything starts to open up, all those changes. And then if the state will give us the funding for the services that we've provided, or the federal funds to get the reimbursement for all the technology we've spent, the money we spent for technology and changing.
Well, if you can do that, Sarah, that'd be great. I'd like to keep an eye on this. I think, what did we say we were going to give back if we were kept on this pace?
$162,000 and change.
Yeah, well, hopefully we could stay there or make it better. Thank you for the answers. Thank you.
It's 162,398, Supervisor Steen. KT, did you have an additional response?
I was just going to share kind of what I had already talked about, that we are being made likely whole because of the work that we're doing related to COVID-19 financially. But again, because we can't supplant, we do need to be careful about levy funded work. And so I don't know how much we'll actually be able to offset and give back. I think the real concern for me is that we've got work that's not being done. And so our immunization rates are falling. Our ISTIs are going up. So we have a lot of chlamydia and even some gonorrhea in the community right now. And so that's not a direct result, but I think that is one of the real difficult things about the public health department not doing the normal public health work that we do.
Thank you.
How is it possible for people to get gonorrhea when they're supposed to be social distancing?
I don't think they're actually social distancing.
Oh dear, I shouldn't be laughing. I really shouldn't.
Immaculate reception.
Anything else?
That might be a good point to end on.
I think it might be an excellent point on which to end. Thank you all. Without objection, I believe that we are adjourned. We will meet again on July 23rd at 5:30, and we'll get you a schedule of meetings for the end of the year. Thank you all.
Thank you.
Stay safe.
Goodbye.
Thank
all.
you, Diane.
Welcome.
Bye.
Chris, you can stop the live stream. Just click the down arrow on the top of the YouTube. Or it says live on YouTube.